We're live.
Hey guys, it's Dr. Emer and we're day one after our male gladiator makeover. Remember our client before, he had a little bit of a hernia in his stomach. He's muscular, but you couldn't see as much of the adhesions, and his chest, even though it's muscular, you could see it's what we call the downward sloping chest. We want to make it more square. So if we take a look now, you could see that his chest after gland removal and lifting is now that angled look. He has a little bit of volume up top now from the fat grafting, and his lower stomach is now leaner, and he's going to be able to start seeing the adhesions in his stomach in the next 6 weeks, really coming in the next 3 to 12 months. Squeeze your stomach for them so they could see that it's not really that bad in look. Even the day after, you could see the lines are starting to come in. They're right here, so you can see them rubbing them right now. There's also ones here around relax, and that's all going to really start to come in and be more defined. The hard part is when you're really lean is that it gets really super swollen. So a big component of making sure that this result is going to be very flat at the bottom and very tight on the sides and the edges of the chest is we do our lymphatic massage. So you can see our massage therapist, Michael, is working really hard to get some of the fluid out, to get movement in the lymphatics, into the lymph nodes, and which will decrease swelling. It'll also decrease the fluid buildup so that there's no hematoma or seroma formation, and also reduce scar tissue and inflammation, which is the key. The one thing I want you guys to see is the angled view of the chest. Look at his chest before. You see all this sagging and sort of looseness on the side. If you come along the side now here, look at that. It's literally there is literally no more side chest. It's all defined on the side. This is just a little bit of swelling that's there on the side here, but it's much more defined. You see the rounded border at the top and more of an angled look to his chest rather than that rounded look. So there's the rounded look here, but you see here the angled look. So right now, go ahead and flex your chest in. Even the next day, you can see the volume here and the tightening. The swelling will all come down. Go ahead and relax. The swelling will all come down and everything will tighten up. And when he starts working out, the angles will really become super defined. Really, we'll start to see a lot more. I'm gonna show you guys his flexing movements. You can see that here. There is a lot of muscle that's under there that will become more visible in the next couple weeks. So right now it's a little harder to see because he doesn't have a lot of fat, but when it all starts, the swelling starts to go down, big improvement. Now, one of the things that he can do to speed this up is after about 2 weeks, we can start something called body tone, which is a muscle toning device. If he did that twice a month, in the next 6 months, the muscles will build and the skin will get tighter along the muscles, which will be really, really good for his end outcome. What else, Michael, should we tell them about massage?
Like you said earlier, it's going to reduce inflammation, reduce scar tissue buildup, anything along those lines, as long as it's getting through the lymph nodes and through the lymphatic system. So very, very important for a surgery like this. We recommend anywhere from 7 to 10 sessions to optimize the best results. And then even after that, at least 2 to 3 times a week coming in for that first or second month.
Exactly. And then that's it. And then he's going to see an overall tighter look. You can already see even at the bottom there was some irregularities through there because of just natural formation of his muscle. And also the hernia, which we'll show you this week, was an outie. You see that poking out. That is going to be an innie when we take the bandage off. So everything is doing great. He's looking perfect. Not too much pain, which is great. That's because we do a lot of plasma heating. And overall, he's healing well. No complications so far. We got a thumbs up. We got a thumbs up. 2 thumbs up. Perfect. And we're going to see him over the next few weeks so you guys can follow the results, because I know all you keep asking about are these end results. We've been posting some great 1 year plus results, which are phenomenal. So if you do your peptide therapy, you take supplements like the B100 that I have at emeragecosmetics.com. There's going to be a few additional supplements coming on very soon that I recommend for your body. You do the body treatments and you work out, you're going to get an ultimate result. Liposuction is not the only thing you need. This is a sculpting and defining. You have to maintain it when you're done with surgery. So take a look again. His before, his after today, and we'll get a final result in the next few weeks. Perfect.